So, but I did come prepared as asked to share a little bit of information first. And so I'll start with that, if that's okay. So thank you for the invitation. And I listened to the last session and I want to extend my gratitude. I love that word and that campaign that Dr. Cusham talked about in Cincinnati. We all owe you who are on the front lines tremendous gratitude for your leadership and how you are, in fact, working to create a new normal. Things are not going to be the same with research, and you've illustrated that. So these are unprecedented times, and it calls for unprecedented leadership. We saw that great map of Mexico. I learned a lot, again, from that great presentation, Dr. Molina. But things are grim right now, and it calls for new thinking, a lot of tolerance, flexibility, and ultimately it also calls for new policies and money, and we're working on both of those. I was really struck by my friend Don Berwick's comment as part of a terrific article, seems like a million years ago, last June, but he talked about how choices are going to create the new normal. And we all have a role in making choices, personal choices, choices as leaders to make sure that we have all voices at the table. And we're making sure that those who come to your institutions for an education have an opportunity to learn about a variety of career paths and new ways, innovative ways of being leaders in the future. We all look to those young leaders to take us through and avoid the next pandemic, for example. I'm going to share some public opinion survey data. One of the things we do routinely, year in, year out, is commission public opinion surveys. So I'll show some of that sprinkled in through this presentation. There's a lot more of this information available on our website or by contacting me or one of my colleagues. The point here is that we saw in August in this survey across parties, very important, and we're going to continue to have a lot of conflict between our political parties and the people who are avid members, shall we say, of those. But we see a desire and an urgent basis to refocus this nation's commitment to science. And I'm sure if the question said commitment to health, we'd get the same kind of urgency expressed. And this is, the levels here are at the mandate level to elected representatives. And that's how we use this kind of survey data and how our members use it. Let me just say a few words about Research America. Many of you, or I should say your institutions, are members of our alliance. Thank you for that participation. If you haven't had an opportunity to think about becoming a partner and a member, I encourage you to do so. Happy to talk about that offline. We are an alliance of institutions, not individuals, about 425 at this point, drawn from these various groups, finding alignment and then speaking with one voice. Some of our strategies for success do include keeping a finger on the public pulse. It helps us and you with messaging. And you can see here some of the other ways we work in advocacy campaigns, and importantly, that we partner with allies. And I'm talking about the AAHC in particular here as a group of our members, if you will, to find ways to work together, because accomplishing bold and important policy and funding initiatives doesn't happen with just a few people being involved. It takes lots and lots of boots on the ground, if you will, a lot of good strategizing, and truly that's what good partnerships are all about. I don't have to tell you, because you're getting push notifications just like I am, about the state of play, not only about the vaccine, What about funding? We don't think the continuing resolution will be ended on December 11th. It might be, but we will get a fiscal 21 funding bill before the year is out. I'm 90%, 95% sure of that. And it could be that a supplemental funding package will be tacked on. A lot going on right now in the Congress to move that forward. We're also, as are your institutions, I know, very concerned about the impact that a number of executive orders are having, and we continue to work hard on those areas. But it is about changing the image of things to come. That's what advocacy is, said quite succinctly here by our former chair, our chair emeritus, John Edward Porter, who is the leader for doubling the NIH budget now some years ago, and still a very strong voice for science and medical and health research in particular. Now, I mentioned public opinion surveys. I'll show you a little more data now. The reason that we keep a finger on the pulse of the public sentiment is expressed very well here, succinctly by President Lincoln. Without it, nothing can succeed. It's that simple. It's critical to know what the American public is thinking and saying about science, about scientists, and about the institutions that conduct it. We have been commissioning surveys for almost 30 years now, and often we oversample minority populations to see whether there are significant differences in responses on a number of issues. Again, referring to the survey of August 2020, you can see here with several little side comments that our goal, which I think is the goal of everyone involved in science and applying science to the delivery of healthcare, is that it benefits everyone. And we will have achieved that goal when we see in a survey like this that 100%, well, we'll take 98% of respondents say that they believe the work that scientists do benefits everyone, benefit all. You can see some of the significant differences. We don't show those that are not significant, but you can see that Hispanics were more likely to say, significantly more likely to say that scientists' work benefits all, but that young people were significantly less likely to say so. And that was true throughout, that sort of trend for both, were true throughout this very extensive survey. We don't know why young people tended to be less supportive in general, more skeptical. We might talk about that afterwards if you're interested, but it is concerning. This is just the top 6 responses from a series. We asked about 20 issues that the US is facing right now. We asked whether people felt that it was an urgent or high priority or not. We're just showing you here urgent and high. And then separately asked whether respondents felt that science, technology, and innovation could help address it, or whether science was essentially a bystander in addressing those problems. You can see here overwhelming, just absolutely overwhelming mandate level, as I said before, demand for attention here. And I can assure you that the urgent is over 50% in these as well. It's not just, maybe 10% people said urgent, half said. And you can also see, which I think is quite interesting, that the urgency of working on other diseases, whether it be ALS in that great presentation we recently heard, or a whole range of other illnesses and conditions that plague us, the urgency is real and it's time to step up to that challenge. Climate change is something that is more and more, as you know from surveys that others have commissioned and from general coverage in the media, you know that people are talking more now about the urgency of climate change. That's certainly true for young people and may help explain some of the other data we saw, disturbing kind of lack of enthusiasm from young people. But even in our own work, we've seen a startling trend of increase in those saying that climate change is harming their health. So this is also just at the urgent crisis level, as is the need to change our public health system. Just overwhelming, as I say, mandate level demand. And that is particularly true from Hispanic and Asian respondents, and very strong across all political identities. We also asked a few questions about STEM education. I'm just going to show you this one about strong approval of government money, federal money, tax dollars, being spent to support research at universities. It does mention basic scientific research specifically. Now, the news is not all good. As you know from other coverage and other surveys, the belief in the benefits of vaccines, for that matter, willingness to be vaccinated, is declining. It's in some ways at a maybe perhaps all-time low. You can see that we have some considerable trend data on this that really just almost takes your breath away. I'd like to be optimistic that this is going to turn around. I do think it revolves around the issue of trust. We've put quite a bit of effort into programming around tackling trust, especially at our National Health Policy Forum last September. Some of you may have dropped in on that either live or later. I believe that it's really important to think about the consequences of how so many more people now than before are watching science in real time, and it's confusing. Scientists change their minds or appear to, and this undercuts trust because we've done a bad job over the years, over decades, of helping non-scientists understand that there's a process involved here. It's not about a linear understanding of data that now gives us the answer for all time and it's settled. No, as Paul Offit says here too, it's important to explain what we know now and what we don't know, and that we're working to find out more. And conveying that kind of message is doesn't necessarily come easy to those in the science community, but we've got to all learn how to do a better job. If we don't, we're going to perpetuate things like the disease of distrust that you may have read, great editorial that Reed Tuckson wrote that appeared recently in Science. It was really bemoaning and I think pointing the finger at the health professional community for not doing as good a job as one we would all hope in helping dismiss this long-standing problem with health inequities and distrust, especially among people of color. We've got to do better. So we all know from a variety of surveys, including the Gallup one a couple of years ago, showing for the first time ever a below 50% public support for higher education as worth the expense of it, shall we say. But there's also been terrible decline in trust of government of all kind. At the same time, though, there's been an uptick in trust in individuals, especially individuals associated with overcoming the crises of the day. We saw that around 9/11 for firefighters and first responders. And we see it here. This happens to be Pew data. And you can see that it goes to April 20. So it's the beginning of the pandemic, if you will. But an uptick, steady uptick in confidence in medical scientists and scientists, however people may distinguish those if they in fact do, in contrast to other leaders in other areas who plateaued out or are declining. This is of long standing. This is not just one snapshot in time, but it does provide, I think, kind of an answer to how to overcome the lack of trust in institutions. It's about putting a personal, individual face, and a lot more of them, on institutional messaging and delivery of messages. This is from our recent work, another indication that confidence in medical professionals and scientists is especially high right now, but in fact, it's been high. It's been at the top along with military and religious leaders for a long time. It's just really because of the pandemic, I believe, especially high right now. You can see that college and university professors are a little bit further down on the list, although not at the bottom, but they are not necessarily equated with scientists, and of course aren't always the same population. So it remains quite concerning to us that there is a tiny, in my opinion, fraction of the American public, to not even be a third of Americans able to name a living scientist. And that has just rocketed up thanks to Tony Fauci, but it's still only a third. And this is another indication that we need to do better connecting to the general public, the public that isn't science educated, it isn't following science all the time, and doesn't even know, by the way, where health or medical research is conducted. This is not a hard question. Naming any institution, company, or organization where medical or health research is conducted. Only about half of Americans can do so, and that percentage is up significantly since a couple of years ago, probably pandemic related, can't prove that, but likely. But this is just almost hard to believe, that people don't realize that the university or academic health center in their community or their state is conducting research. They know they're treating patients. They likely know there's education going on, but they don't automatically know that research is conducted there. So another area that needs work. Similarly, and I think you'll immediately see the political implications of this one, that more than half of Americans don't know that research, and this is all kinds of research here in the US, is conducted in all 50 states. Now, this has gotten better over the last couple of years, but it's still just abysmal. And if the congressional delegation from states rarely hears from the voter, forget about hearing from presidents of universities and deans, they do hear from them, but they don't hear from the regular voter that it's important for them to support science or research of any kind. And that is partly because they don't realize that it's right there in their backyard and an important part of the economy, as well as literally the health of the community. So I hope that you as leaders working on creating the new normal will commit to increasing the visibility of science and the people who conduct it. Think about changing the narrative. Stop talking in ways that boil down to lectures to the non-science public, and talk about stories and talk about defeating the next pandemic, for example. Talk about things that people can easily connect to and that answer their questions rather than rather than speaking in the way as you would to your scientific colleagues. Another thing you might consider leading on is changing things on your campus to be sure that you're supporting or creating, if necessary, student science policy groups. Students we know are just so eager to be empowered to engage the broader community. We have a micro grant program that's now going into its third round of awards to help small organized groups of young scientists and students connect to their community. And they've come up with some extraordinarily clever ways to engage virtually during these times of the pandemic. And they want to know that this is a sanctioned and celebrated activity by their mentors and leaders on their campus. We've been working at Research America and just submitted a couple of months ago a plan for what we call modernizing the relationship between scientists and the public. There's a lot of opportunity to work with us here. We'd love to work with you to work on curriculum and other ways to assure that everyone who is trained in the sciences becomes proficient at public engagement. There's a lot of ways to go at this. It'll benefit the nation, it'll benefit individual institutions, and certainly will benefit young people. There's I wanted to bring to your attention, a new call to action, a national plan that hasn't been publicly launched yet, but will be soon. If you want to know more about it, it's very bold. If you want to know more about it, you can get in touch with me. I can send it to you, send the URL. I didn't think to put it on this slide. It's extremely bold. It calls for putting the science advisor to the president in the cabinet room. It calls for bold, coordinated action across the science agencies and the private sector to address existential threats. And it calls for doubling our federal commitment to research and development and STEM education. There's obviously details about all of that. These are the people who are involved in putting this together. It's not an academy study, it was self-initiated, if you will, and people participated as individuals, not as representatives of, for example, the National Academy or the Gates Foundation, but as extraordinary leaders all. Another report that it has been out now for a couple of months and is updated all the time is well worth your taking a look. And this is work that the AAAS has done under its 1 year now in Leaders Sud Perique to address problems in diversity, equity, and inclusion that we've all known have been there at AAAS and at virtually everywhere, every institution, every organization. But we've been giving too much lip service to this challenge and not enough action. And the AAAS is determined to change that around, starting with themselves. It's quite worth your time. But the bottom line is to be a change agent, to meet the moment right now. The new normal is going to be different, and it calls for you. And I am grateful for you for all that you're doing, and look forward to the opportunity to work for you, with you. We believe the four most important words that anyone in the research and science community can say and convey is, I work for you. And then listen to find out what it is that's on people's minds and how we can help. And that's what I'm here for, and I look forward to our conversation. So thank you.